In Section 3, we'll examine how bloodborne pathogens are transmitted. Bloodborne pathogens are transmitted through contact with blood or other potentially infectious material from an infected person. The blood or other potentially infectious material of an infected person must enter the bloodstream, either directly or indirectly, of another person. Transmission occurs when the bloodborne pathogen leaves its reservoir or host through a portal of exit, is conveyed by some mode of transmission, and enters through an appropriate portal of entry to infect a susceptible host. This is sometimes known as the chain of infection. From an epidemiologic perspective, breaking this chain or eliminating one of the key links will reduce the rate of transmission. Look carefully at some ways this can be done. The mode of transmission piece of this chain can be altered by using work practice controls or engineered Sharps devices. Portals of entry can be protected by always using appropriate personal protective equipment. And the susceptible host piece can be altered by utilizing vaccines whenever available. What are modes of transmission for healthcare employees? 1. Percutaneous injury or needle stick injury. This is the penetration of the skin by a needle or other sharp object which was in contact with blood or OPIM before the exposure. 2. Mucous membrane. This occurs when blood or OPIM come in contact with a mucous membrane such as the eyes, nose, or mouth. 3. Non-intact skin. Occurs when blood or OPIM comes in contact with areas of the skin that have openings from cuts, abrasions, dermatitis, or chapped skin. 4. A bite. Although uncommon, this is also a possible mode of transmission in the healthcare setting. How is HBV transmitted? HBV is generally transmitted percutaneously or through mucosal contact with infectious blood or body fluids. Common modes of HBV transmission are blood-to-blood contact, unprotected sex with an infected person. This is the most common form of transmission. HBV is 50 to 100 times more infectious than HIV. Sharing needles or syringes with an infected person. Perinatal transmission, spread from an infected mother to her baby during birth. Sharing items such as razors or toothbrushes with an infected person. Needle stick or other Sharps injury in a healthcare setting. However, HBV is not routinely spread through food or water, sharing utensils, hugging, social kissing, coughing, or sneezing. How is HCV transmitted? HCV is usually transmitted percutaneously when blood from an infected person enters the body of an uninfected person. Generally, this is from large or repeated percutaneous exposures to infected blood. Common modes of transmission are sharing needles or syringes with an infected person. 1/3 of young injection drug users are HCV positive. Older users have an even higher rate of infection. This is the most common form of HCV transmission. Needle stick or other Sharps injury in a healthcare setting. Children born to an HCV positive mother. Before 1992, when widespread screening began on blood products, HCV was commonly spread through blood transfusions or organ transplantation. Less common modes of transmission of HCV include unprotected sex and sharing personal items that may have come in contact with an infected person's blood. HCV is not spread by sharing eating utensils, breastfeeding, hugging, kissing, coughing, or sneezing. Because HBV can survive up to 7 days outside the body, and HCV can survive up to 3 weeks at room temperature on an environmental surface, practice hand hygiene frequently and always follow the recommended guidelines for disinfecting surfaces. How is HIV transmitted? Only certain body fluids can transmit HIV. These are blood, semen, rectal fluids, vaginal fluids, and breast milk. These fluids must come in contact with a mucous membrane, damaged tissue, or be directly injected into the bloodstream for transmission to occur. Common modes of HIV transmission include unprotected sex. Anal sex is the highest risk sexual behavior. Using needles or syringes from an HIV-infected person. In recent studies, it's been determined HIV can live in the barrel of a used needle up to 42 days, depending on temperature and other factors. Less common modes of transmission of HIV include perinatal transmission. This can occur during pregnancy, birth, or breastfeeding. The current recommendation is to test all pregnant women for HIV. Needle sticks or sharps injury in a healthcare setting. As of December 31, 2013, there were 58 confirmed cases of occupational transmission of HIV and 150 possible occupational transmissions in the United States. Rare modes of transmission of HIV include receiving infectious blood through a transfusion. This was more common before rigorous screening of blood products was put into place in 1992. Being bitten by an infected person. The skin must be broken and usually with extensive trauma. Contact between broken skin, wounds, or mucous membranes and HIV-infected blood or the body fluids. HIV is not transmitted by air or water, mosquitoes or ticks, saliva, tears, or sweat. Blood must not be present. Shaking hands, social kissing, or toilet seats. What is the statistical risk of infection after an occupational exposure? The Center for Disease Control reports that the risk of infection from a single needle stick or sharps injury following an exposure to HBV-infected blood is 6 to 30%. However, if previously vaccinated against HBV, this is effectively reduced to no risk. The risk of infection following an occupational exposure to HCV-infected blood is 1.8%, and the risk of infection following an occupational exposure to HIV-infected blood is 0.3%.